So I'd had issues with my nasal passages for a while now. It's been affecting my sleep and more so of late. And so with like the dryness in one part of my nose and then like the closing off here because of the deviated septum, it just made sense to come in and see if there was anything that could be done. I think the surgery we're hoping is going to help alleviate some of the issues with breathing, especially with the reduction in some of the turbinates, etc. inside that are causing some of the discomfort. And hopefully long term, I'm hoping that it'll allow me to use my sleep apnea mask, which in turn then will help me generally with things like having energy, etc. throughout the day. The doctor was very helpful, but also willing to answer all the questions I had multiple times, in fact, at each of the different visits, and that was probably the best patient care I've had for anything like this. And even with the procedures of like the scope, etc., the doc ran me through all of it during and explained everything, and even with the CT scan, it was great to be able to sort of get the pictorial representation of what's going on, and to have him sort of guide me through it was really helpful as well.
So the operation seemed to go, or surgery I guess would be a better word to use, went rather well yesterday. I didn't really notice any real pain. I think I didn't even really need Tylenol that night or this morning, so that's excellent. So that was good to find out. Beyond that, there of course is discomfort, but that's by virtue of the clogging overnight. But that overall was not too bad. I was able to sleep through it, and then coming back next morning here, we were able to clean it out, and being able to breathe through my nose again gives me a lot more comfort knowing that the next few days it'll just get better. And then overall, I would say it was a more pleasant experience than I thought that it would be, given just what I'd read online, etc. So I think the team did a really good job of making sure that everything went smoothly, and I came back the next day, so I'll be invited back in a few more days to take out the splint, after which I believe it should be significantly better. So overall, I'm very satisfied with how it went and how it has been going so far after the surgery. I am feeling a major improvement now in terms of being able to breathe from both sides of the nose.
All right, so we're about 1 month after your procedure, and if you can briefly tell us, if you recall, what were the kind of issues that brought you in and you're hoping to have improved or resolved from what we've done for you.
Sure. So I'd had a really hard time breathing at night. There was blockage on one side that was essentially impossible to breathe through. The other one would keep closing, making it hard to breathe out of my nose at all. And that had been uncomfortable for a really long time, aggravating my sleep apnea very likely, and so I definitely wanted to take care of that to sort of rule out that as an issue in terms of nighttime breathing. I also had post-nasal drip that was pretty annoying. I had to clear my throat a lot, and it was uncomfortable. And even, with like Mucinex and stuff, it actually ended up like irritating my stomach. So that hasn't been an issue at all since the surgery. And there was, like, in terms of cosmetics, there was a deviated septum, and so it definitely, you could tell that there were some issues going on, and so also I needed like peace of mind to know that that wasn't really an issue. It turned out it was a bigger issue in the back where I couldn't see it than it was in the front, and so I was glad to figure that out as well as part of the process.
Great. And how's your sleeping been now since the procedure?
So the sleeping has been rather good as far as I can tell in terms of being able to breathe through the night. There's no issues in terms of blockage. I'm not being forced to breathe through my mouth or anything like that. And although I haven't started using my CPAP machine yet, I'm assuming and hoping that it will allow me to sleep properly throughout the night, whereas I am waking up every 4 to 6 hours, which isn't necessarily related to the breathing at all, but I'm definitely looking forward to sort of resolving that.
Great. And you've had to compare, I guess, give a gauge of where you were in terms of how well you're breathing before and now. Just a quick comparison. Any thoughts on that?
Yeah, if I were to talk about just generally throughout the day, especially in the wintertime, it's definitely significantly better. I haven't, since the last cleaning, I haven't had any issues in terms of breathing during the day or having to blow my nose in order to be able to breathe or anything like that, which used to happen on occasion with the wintertime. And of course at night, as I mentioned earlier, there's no like over dryness or anything like that happening. So whereas before I couldn't breathe through one nostril and had a hard time with the other, I can breathe through both at night, and there's no issues. And I used to, at night when I'd wake up, I would notice it like unclogging over the course of like the morning, and that's not happening at all because there's no sort of drain, no blockage at all. So definitely very satisfied with the results.
Great. And then given the opportunity to do it again, would you recommend having this being done, or?
To someone else in my position, like in that position, absolutely, I would recommend that it be done. If nothing else, for the peace of mind, but also the pragmatic improvements in terms of being able to use my CPAP machine properly now, and not having issues with post-nasal drip, etc. I think it's very much worth it. Even with like that initial first week discomfort with the healing, it's worth it in the long run, absolutely.